Hello everyone, my name is Will Steichleather, and this is my final video project on the chemotherapy drug Bendamustine. Of note, I couldn't figure out how to get my footnotes to fit somewhere into the slideshow, so each footnote is indicated on each slide, and then on my citations page it is correlated with the appropriate article that's cited. So just a little note on that. So for a little introduction about bendamustine, bendamustine is a chemotherapy drug that is used to treat patients who suffer from chronic lymphocytic leukemia. And the drug is also being researched for its effectiveness in treatment of non-Hodgkin's lymphoma. The drug was actually invented way back in the 1960s in East Germany, and despite these origins in the mid-20th century, bendamustine wasn't fully studied in clinical trials until the 1990s once the German reunification occurred. And as a consequence of this, the United States didn't really begin developing bendamustine or researching it into the early 2000s, and it wasn't until 2008 that the FDA approved the drug for use. Bendamustine works via injection, and it kills rapidly dividing cells such as cancerous lymphocytic cells. Bendamustine is sold under the brand names of Treanda and Bendeka. Treanda was the first brand name to come out in roughly 2012, but it was improved upon in 2016 with the release of Bendeka. Bendeka has supplanted Treanda because it has a shorter infusion time than Treanda, which is very advantageous for patients. And the generic name of bendamustine is bendamustine hydrochloride. There are some side effects. The majority of them are minor, such as fever, nausea, vomiting, fatigue, diarrhea, rash, or a loss of appetite and weight, but there are some serious side effects as well to bendamustine, such as a low blood count. If your levels of white and red blood cells and plasma decrease, this will potentially expose the patient to infection or anemia. Bilirubin is a compound that is produced by the liver, and taking bendamustine may cause the amount of bilirubin in a patient's blood to increase, indicating that there's temporary liver dysfunction. And also tumor lysis syndrome is a rare side effect, but it may lead to kidney failure, and also infertility has been linked as well. So here's the Lewis dot structure of bendamustine and the molecular formula. There are 16 carbon atoms, 21 hydrogen atoms, 2 chlorine atoms, 3 nitrogen atoms, and 2 oxygen atoms. As you can see, there are several areas where there are lone pairs, specifically over oxygen, nitrogen, and chlorine, which we'll get into later when we're talking about polar bonding. And finally, this is based off of molview.org, which is actually the same software we use for experiment 4 for our lab. So a little crossover there. So here is my take on the structure of bendamustine. I'm not a great drawer, and I don't have a stick and ball chemistry assembly set, so I had to make do with styrofoam and tape and toothpicks, but I think I did a decent job here. As you can see, all the 16 carbon atoms are indicated by the red tape. Hydrogen are clear white, chlorine is green, nitrogen is blue, and oxygen is black. Here's another view of it if you wanted to see that it's kind of in 3D form. Obviously, I couldn't get the bond angles entirely accurate, but I tried my best. And unfortunately, the bottom hydrogen atom is cut off, but you can see it in the other picture. So here we have the bonding and geometry of bendamustine. I try to color code the diagram to make things easier. All blue arrows indicate where the electron and/or molecular geometry is for each central atom, and the red arrows indicate polar bonding and direction. In general, most electron geometry, especially with regards to the carbon, is trigonal planar due to the double covalent bonding which is occurring. All indications of different molecular geometry had to do with either oxygen or nitrogen, which were typically had trigonal planar or tetrahedral electron geometry and trigonal pyramidal or bent molecular geometry. And due to the polar bonds within bendamustine, dipole-dipole intermolecular bonding is present between two. Well, it is possible for bendamustine, but the strongest intermolecular bond that can occur between the bendamustine molecules is hydrogen bonding, which occurs between the oxygen and hydrogen atoms. So that's what we got for bonding and geometry. So the article I found is about how bendamustine is changing how lymphoma is treated. So before, non-Hodgkin's lymphoma was typically treated by CHOP, which has a really long name. I'm not going to try and pronounce that. But with the advent of Treanda back in 2012, typical treatment is now changing. Treanda is now frequently combined with another drug, which is used for the treatment of non-Hodgkin's lymphoma, to treat patients using methods that are less toxic and aggressive than CHOP. And the change has happened very quickly. In 2012, CHOP was being used only 16% of the time as first-line therapy, while bendamustine was used 71% of the time. And this is because it's less aggressive and toxic than CHOP. So while it's not as effective versus very extreme cases of lymphoma, bendamustine is a good first line of treatment against the cancer. Ultimately, bendamustine appears to be a quote-unquote great alternative to CHOP, but it's not the end of CHOP. CHOP is used for the most extreme cases, but for now, bendamustine is a much safer and less toxic alternative to lymphoma treatment. So with regards to lymphoma, bendamustine is definitely a win for patients, but there are other options available. And here are my citations. I hope you enjoyed the presentation, and I hope you have a great rest of your fall. Thank you.